Hi, I am Dr. Mini Salunkhe, consultant obstetrician and gynecologist and director of Momstory, Hadapsar. Today, let's talk about a common concern in pregnancy, that is reduced amniotic fluid, also called oligohydramnios. So why does the amniotic fluid become less? There may be several possible reasons, like the patient may be leaking amniotic fluid slowly, off and on. There might be some maternal causes like high BP or dehydration. Placental causes are also known, which would reduce the perfusion to the baby and reduce the amount of amniotic fluid. The fetal causes of reduced amniotic fluid are also known, like urinary tract problems or kidney problems in the fetus. Last but not the least, even postdatism. If the patient has crossed her due date, slowly this amniotic fluid may become lesser and lesser. What are the common symptoms of oligohydramnios? Sometimes the pregnant woman may not be able to tell you that the amniotic fluid is lessening because she doesn't have any symptoms. But in some cases, she might tell you that off and on she has had leakage of amniotic fluid, or the movements which were good are slowly reducing or have suddenly reduced. So the only way sometimes to know that the amniotic fluid is decreasing is through serial ultrasounds. So how do we diagnose less liquor or amniotic fluid in the pregnancy scans? The sonologist would typically take the measurement of the amniotic fluid, which is called the amniotic fluid index or the AFI, in the 4 quadrants of the uterus, or they may check the deepest vertical pocket of amniotic fluid. So how would you treat low amniotic fluid? You must never skip your routine antenatal visits. Don't ignore the symptoms of decreased fetal movements or leakage of liquor. Leakage of liquor may be mistaken for vaginal discharge, but you must always visit your obstetrician for the same. The treatment of high maternal BP, diabetes and growth restriction is also very important to prevent oligohydramnios. Treatment depends on the cause and the stage of pregnancy. In case the pregnant woman is leaking liquor, then the treatment of course goes according to that. She must never mistake the vaginal discharge for leakage of water or urine and immediately contact her obstetrician. It is very important to stay well hydrated and have your regular ANC checkups and regular scans. In case there is any problem of reduced fetal movements or leakage of liquor, please contact your obstetrician immediately. Remember one thing, decreased liquor may not be a serious cause of concern, but in case there is some concern regarding the placenta or the fetus or the maternal causes of growth restriction, oligohydramnios with some comorbidities, then immediately contact us. If the patient is near term with leakage of water or oligohydramnios because of some growth restriction or some maternal conditions, delivery may be recommended. For more information, please contact us in Momstory, Hadapsar.